So much for sticking with us. It is 7:43 on your Saturday. According to breastcancer.org, about 1 in 8 U.S. women, we're talking 13%, will be diagnosed with invasive breast cancer during their lifetime. In 2021 alone, more than 280,000 new cases are expected to be diagnosed. It is Breast Cancer Awareness Month, and it is so incredibly crucial that we do raise awareness. Let's bring in Dr. Pannucci now. Doctor, tell us a little bit the importance of catching breast cancer early, going to those regular checkups. It truly can save your life.
Well, good morning, Haley, and thank you. I think that the number one message for any woman listening to the news this morning is that the American Cancer Society has an established recommendation that every woman over the age, 40 and over, gets an annual screening mammogram. And that's because screening mammograms are known to promote early detection and therefore save lives.
And how often should women be getting these mammograms?
So the recommendation for the general population is an annual once per year screening mammogram. Certainly embedded in the 1 in 8 risk population that you mentioned, there are patients at higher risk, and those women may choose to establish with a breast care clinic early to determine whether, in addition to mammogram, other screening modalities like ultrasound or MRI might be appropriate. But certainly mammogram is the most important for every woman.
Absolutely. And, especially women who do know that it runs in their family. Maybe their mother has gotten it, a grandmother. Tell us a little bit about how, kind of looking into your family history really can be life-saving as well.
Yeah, and so as mentioned earlier, the general population of all females has a risk of 1 in 8, but there are women who are at much higher risk than that. Women with a strong family history and also women who have a known genetic mutation like the BRCA mutation can be at much higher risk, 30% or 50% or even up to 80% in their lifetime to develop breast cancer. Those are women who would best be treated, not treated, but surveilled in advance and established with a medical oncologist or a breast care clinic to be regularly seeing them to ensure that breast cancer is not developed.
And your advice to women at home, where should they turn to if they perhaps don't have a established physician? Where is the best place they can go to try to, start getting some of these regular annual checkups and just make sure that things are looking okay?
Yeah, I think everyone should have a primary care physician to start. I certainly have one. And your primary care physician can be your initial quarterback in coordinating your care. And they are generally the individual that's going to order your annual screening mammogram so that you can make sure to have that on time. If there's additional referrals to be made in your community, your primary care doctor would definitely have the resources to do that.
All right, Dr. Chris Pannucci joining us live talking about Breast Cancer Awareness Month. Truly is life-saving information out there. We appreciate you, doctor. Thank you so much for your time.